Hello, my name is Professor Tim Noakes. I work for the University of Cape Town and the Sports Science Institute of South Africa. And my role in this series of videos is to try to help you change your life so that you can become healthier and enjoy life and perhaps even live longer. The title of this message is Do a Stock Take on Yourself. The reason why we want you to take stock of your physical health before you start exercise is really for two reasons. Firstly, there is a small risk that people die during exercise because they have pre-existing conditions which then cause them to die. And our focus is to try to identify those people and reverse those factors so that it then becomes safe for them to exercise. And the second factor is that it's very difficult to train if you have orthopedic problems. So we need to address the orthopedic problems. As you get older, the probability that you've got some disease of your coronary arteries rises. And so this becomes the disease that causes us the greatest concern. We don't want people with established or advanced coronary artery disease suddenly starting an exercise program. Before you start exercising, it's crucial that you should fill out the questionnaire on the website. Now, those questions are designed to identify anyone who is at slight risk when they start to exercise. So if on that questionnaire you answer yes to certain questions, that'll indicate that it's really not right for you to start exercising before you've seen a doctor. So what you need to do is have your doctor assess all those variables in you, not just because you want to be physically active, but in fact, because it's important you should know what those factors are and address them to reduce your risk in the future. It's also important to understand that if you suddenly load the body, it is very probable that you will become injured. And particularly in running, it's important that the first 3 to 6 months of the activity, you should restrict how much you do in order to allow the bones and tendons to become stronger. And then once you've been going for 6 months, the probability of injury is much reduced. So I often advise people that if they want to start a running program, in fact, for the first few months, they should do more walking than running. And only when they've been active for 3 to 6 months is it possible for them to start running all the time. So remember that if you have been physically inactive, your bones and your ligaments and your muscles and your tendons take a long time to adapt to the training. And you must allow them the chance to be fully functional and to become strong enough to cope with the training that you want to do in the future.